Health experts say children make up more than 7% of all coronavirus cases in the U.S. Kids, by the way, represent about 22% of the nation's population, to give you some perspective. And the number and rate of child coronavirus cases have been steadily increasing. As some push for a return to normalcy and others fear returning to class could prove deadly, the debate rages on and people question, is it safe? Duval and a number of other local districts go back later this week. Epidemiologist Dr. Jonathan Kantor with the Penn Center for Epidemiology joins us once again here on the morning show. So moms and dads remain conflicted. Pediatricians still say we're flirting with danger here. Do you think brick and mortar classes will be able to remain open?
Well, I think we're definitely going to try. I think, that cat is out of the bag. And I think, if there's one thing we've seen, it's that the state of Florida is definitely heading towards that. And we're starting in that direction. Whether they're going to be able to remain open, I think, Bruce, is really the key question, because I think you already reported this morning on a couple private schools in the area that are already having trouble. And so that, I think, is really going to be the challenge. There's the simple issue of, can we open? Absolutely. You can have an order, you can have a decree, and you can open the schools. But whether it's going to be viable to continue or what steps we're going to put into place to say, hey, these are the checkpoints at which we say we need to quarantine a classroom or quarantine an entire school, those are the things that remain to be seen.
Kids are going to be kids. You're a dad. I'm a dad. You and Bella have kids, but you're also a doctor. If the kids are going to go back to class, what do we parents need to impress upon our children, and what's the best approach with them?
Well, I think that is a really age-dependent question. So I think for younger kids, the key thing is we don't want to scare the kids too much. We don't want to, really throw them off. We need to tell them about things they need to be cautious, just as they would from the cold or the flu. But we also don't want to overly scare. We don't want to traumatize younger kids. Just as there's been a lot of news about mental health outcomes in adults, we definitely don't want to create a generation of stressed out kids. That said, there are certain basic things that we can take the advantage of to really work on educating. So things that we always tell the kids to do, hand washing, etc., those are great moves. Hand sanitizer would.
All right, he froze up on the internet there. We'll give him a chance to go ahead and reconcile that. He was talking about hand sanitizer. Then there's also the mask issue as they work in the booth to try and get Dr. Kantor back. I know Emily came home yesterday, and it was the first full day at school, and she said, it's really tough to wear the mask all day. And I know at her school and some others, they basically have a place to go ahead and take little mask breaks. Okay, I think we got Dr. Kantor back.
I'm back. I can hear you.
Go ahead. Pick it up. You were talking about hand sanitizer.
So I think hand sanitizer, as long as you can get a hold of the good hand sanitizer, make sure it's not any of those kind of sketchy ingredients that have been out there. But as long as you can get a hold of reliable hand sanitizer, that makes it much easier for children. And I think that's always a good idea because you want to make things easy. You want to lower the bar for them. And then the other things are going to be things like the mask wearing, etc. Kids aren't really going to social distance effectively. That's just not reality. And so all we can do is encourage them to do the smart things that we would normally say. Try not to touch your face, clean your hands, use hand sanitizer, and then really wing in a prayer from that point on.
And, I think the teachers need to say, look, if you need a mask break, because it's hard. I was just talking about that when you froze up there. Emily came home yesterday. It was the first full day. She says, I felt like at a point I needed a mask break. So sometimes the teachers are going to say, okay, if you need to go in the corner and bring it down for a couple of seconds, we should allow that. Head to another issue. Vaccines are safe, but huge numbers of people around the world say they wouldn't take a COVID jab. And I'm not just talking about anti-vaxxers here.
Right. So that is one of the really scary things. And, the question is, how do we make it more palatable? And I think one of the concerns that people are raising, and I actually understand this, is to say, listen, I'm going to give my kids the measles vaccine. That's been around for years and years and years. Millions of kids have gotten it. They've been okay. We know from the data that that's safe. Here we have a brand new vaccine. How do we really kind of engage the public to show that this is going to be safe and this is going to be effective? And I think one of the key things there is to say, listen, look what the doctors are doing, right? Look what the pediatricians are doing for their own kids. Look what your doctor is doing for themselves and their family and their staff. Overwhelmingly, you're going to see the doctors really going for it. Those are the people who are most qualified to make those judgments and make those assessments. And again, we are studying this very, very carefully. We're using established vaccine technologies. I will say that there's probably going to be a little more hesitation with some of the newer platforms out there. But for the established vaccine technologies, the question is, what's the worst that's going to happen? In general, it's going to be having a fever, not feeling great, having a headache. But again, compared to COVID-19, for yourself, for your family, for your community, it's a no-brainer.
So basically, you've got nothing to lose. Dr. Jonathan Kantor, always appreciate your insight.